Welcome to Success in Motion. Join us as we dive deep with top leaders, entrepreneurs, and professionals, uncovering strategies to grow, scale, and succeed.
Welcome back to the Success in Motion podcast. I'm your host, Alex Burhoe, and today we're going to be joined by Paola Bianchi Delp. And she has been involved with innovation and really disrupting the current healthcare system. And so, Paola, thank you so much for joining us today.
Alex, thank you so much for having me. I appreciate the ability to get together with you and chat a little bit about what we're doing.
Absolutely. So, I know you're disrupting the current healthcare system, and we all want to hear more about that. So, can you just give us a quick snapshot of what it is you're working on and a little bit about your story?
Sure, happy to do so. Well, I'm currently the president of CareNew, which is a management service organization that is owned by Chapters Health System. And I'm also the CEO of Secure Health Plans, which is a brand new Medicare Advantage iSNP plan that we launched in January of 25. And what's unique about us is CareNew was launched during the middle of COVID, when everybody was, basically kind of reflecting and hiding, because the world had just drastically changed in an instant. We trailblazed and we leaned in. So I think that was a very unique position for us. And what I mean by that in particular was we launched in 2021, and we launched under one of our subsidiaries called Assurity DCE. And we did a demonstration project with CMMI, which is the innovation arm of CMS that runs Medicare and Medicaid. And we went ahead in April of 21 and was one of the original 6 high needs DCEs in the country. And it was quite exciting because it was a lot of unknowns. It was a new model. It was the first time providers can take total risk without being an insurance company. And we were able to be there from the ground up and have the opportunity to evolve with the model, to have influence on model changes, and really test, if you will, what that theory would look like. That was extremely important for us, Alex, because obviously, looking ahead, that was 21. We then went ahead and filed to have a different product line within our, portfolio of services to launch a Medicare Advantage high needs iSNP plan. And we did that in January under the name of Secure. So everything we learned and the tools we learned there, the evolution we had, the quick pivots, we had regulatory changes to deal with, we had model changes to deal with, administration changes to deal with, even it went from a name rebranding as well to ACO Reach. All of those gyrations and evolutions created an organizational culture for us to be able to do quick pivots and quick changes and respond to needs that were identified in a rapid fashion. So that was a great learning experience for us all. And it has been really the chassis that we have built Secure Health Plans under.
Now, there's a lot to unpack there. So let's kind of start with first that launch during COVID, then we'll talk a little bit about this new one you've come in. I know you said when you guys launched, a lot of other people were pulling back and you guys no, we're going full steam ahead. What kind of inspired you to go full steam ahead when so many people were doing the opposite?
That's a great question, Alex. I think I'm a first generation born in this country. I came from an immigrant family, as much of America has been built. And the wonderful thing about coming from that kind of cultural background and family background is that there's a wow element in your DNA. You know, you believe that you're kind of Joan of Arc-ish, and you believe that you can do it. And that has been very much my framework throughout my business career. And it was one of these, there was a lot of unrest in healthcare at that moment, a lot of trepidation, as you can imagine. So it's in those times that an industry is rocked, if you will, that innovation really blossoms. It's just, you know, the prime environment for it. So that's really what we did. We wanted to test what it looked like to really deal with the most vulnerable patients that had chronic multiple conditions, that were putting the most financial and emotional and workforce burden, you know, on the industry. And how can we partner, truly partner? How can we collaborate with our providers? We have to kind of, when you're looking at something like this and you're challenged, and the beauty is, you know, you are a startup, so there is no roadmap. So you get to design and be flexible and change quickly and do all of those really exciting things, because you're not caught up in the status quo, if you will, right?
Yeah.
And in healthcare, unfortunately, Alex, what we've been doing for a long time is, when a lot of these programs were developed, like Medicare, you know, you keep hearing by 2030, all of the baby boomers will be Medicare aged. We have a healthcare workforce shortage. We have a system that churns on a fee-for-service side. And if you look at the health status of the population of the United States compared to other countries, we spend more money than any other country on healthcare, but we're not improving the healthcare outcomes and conditions of the American population.
Hmm.
You have to almost, as a leader in the industry, you know, and as an executive, you have a responsibility to assess. We have to do something different, right? And test it. And if it doesn't work, it's okay. At least you tested it and you try something else, right? And being an immigrant family, there's kind of like a fearlessness about you, you know, and you see it in your family, you see it in your parents, you see it in the people around you. So I never felt inhibited that I couldn't do it.
Yeah.
So you just have to kind of throw yourself in. And I think that's very much my ideology. And it's really the organizational culture that I embrace and I support and build within my team.
Mhm. So, as you've been implementing some of these changes or trying to make it a little different, what differences have you seen with the outcomes of the people you're working with? Like, how have you been disrupting this industry?
That's a great question. We use a lot of analytics. I know it's a controversial subject of AI and predictive analytics. We use those in a lot of modeling, if you will. We use it as not a decision maker, and it doesn't replace the human element. We use it more as a tool in our toolkit. So we try to ingest data from all sources, from, you know, electronic medical records, from labs, from pharmacy data, and develop a profile, if you will, on what are possible indicators or metrics that could be forthcoming in the future that create alarm or a spike of an incident, for example. And we try to, at that point, after we model and stratify, to intercede proactively before that event occurs. So that means a larger engagement with our very, vulnerable, high-risk population on everybody wants to be in their home, for example, whatever home is. Nobody wants to be in a hospital. So if we feel that they're showing signs that they're having a decline of their condition, we will send our case managers, our nurses, our social workers, our behavioral health, because we have an interdisciplinary team, to interact with them, hopefully at a greater frequency prior to that sentinel event happening. So that is part of like basically it's honestly not rocket science. You know what I'm saying?
Yeah.
It's just using analytics to help you assess your resources more proactively and try to create a positive change.
Now, as you've been trying to be a little bit more proactive with these more complex patients, what would you say has been some of the challenges you've had in implementing this newer program?
A lot of it, quite honestly, it's heavy education. It's heavy education with your provider partners. And your provider partners are your hospitals, are your physicians, are your home health agencies, are your nursing homes, your assisted living facilities, on and on and on, correct?
Mm-hmm.
And because the system has generally, and I don't want to maybe use incentivize, but the system supports, come back with frequency. And the more you come back with frequency, it's not necessarily outcome related. It's more so volume and transactional related, right?
Right.
So you have to look back. If we want to go ahead and maybe fix that wound, we need to be measuring that wound's not getting bigger.
Mm-hmm.
So if we're doing a certain care plan and modality on something and you don't see effective change, then why are we keep doing the same thing? Those are the challenging questions we have to pose back.
Mm-hmm.
So we don't try to do that, we try to intervene on that. What we'll do is we'll go ahead and say, we're expecting X results by X date. And if that doesn't happen, we need to try something different. So I think it's really key to go ahead and say, what are the outcomes we're looking for? We're looking at days at home. We're looking at a reduction in hospitalizations, in readmissions, in falls, in all of those key metrics that improve a patient's quality of life.
Mm-hmm.
And those are the metrics we monitor. Even if you're looking at sometimes even folks are on many medications that contradict each other. So the human body is such a sophisticated machine. We have to keep adjusting to the needs of that patient and their conditions where they're at. And what was there 2 years ago doesn't mean that it applies today. And too many times in healthcare, we're on medications, we're on things that you've been on for years and years, and maybe they're not even effective anymore.
Now, as you've been holding, physicians and care practitioners to kind of this higher standard, have you gotten much kickback from them, or how has it been getting them on board?
That's a great question, Alex. It is a new way of doing business. It absolutely is. And it has required a lot of grassroots efforts, Um, we're all my team is extremely accessible, and we pride ourselves in being a phone call away, a text away from engaging with we don't really see them as just our network. We see them more so as our partners in care.
Mm-hmm.
And we're constantly, boots on the ground, side by side, rounding with our providers, visiting in the nursing homes, visiting in the ALFs, and we're at that bedside, hand in hand with them, looking at that patient and their condition, which is kind of interesting because overall, we're kind of going more to a virtual, type of healthcare delivery system. Virtual healthcare works from maybe a maintenance perspective, but when you have an issue that's not improving, healthcare still has to happen at the bedside,
Yeah, absolutely.
and we
Need
can't get
someone
away.
there. You need someone there actually looking at what's going on rather than just talking.
Yeah. And like I'm saying, remote patient monitoring, there's a space for it
Mm-hmm.
from a maintenance standpoint, a very overarching check-in, right?
Right.
But it can't be your day-to-day delivery system.
Right.
And again, it's just something else in that tool chest.
Mm-hmm.
And there's a lot of, energy, if you will, in the healthcare environment about some of these things. But you have to go back and look at, it's not one dimensional.
Mm-hmm.
You have to have everything work, like a web to produce the best outcomes for the patients. And all of us deserve that.
Mm-hmm. Absolutely. So, what would you say are some of the plans or initiatives you have coming up in the next 6 to 12 months to help kind of further and help these patients, just as we're wrapping up our interview?
Some of the things that will help these patients. Well, right now we are in the midst, I don't know how familiar you are with, the process that happens
Mhm.
in designing a health plan. But right now we are in the midst of designing our 2026 bid on our benefits. So that's a lot of rolling up your sleeves. It's a lot of seeing what has worked. And I'm basically, my team and I are dissecting what are the benefits we offered and what was utilized, and where do we feel that we have gaps of things that we may not be addressing, that we have to change our benefit design to help address those things. And I think that's really key, because if you are trying to customize, and we're intentionally trying to customize our offerings to the identified needs of the niche population we serve.
Mhm.
And I'm sure that that's probably a little bit different approach. How
Yeah.
many health plans do you see do that? Or are they just trying to kind of do something for the market off the shelf, like just a little bit better than their competitors, right?
Mhm.
So I think the angle that we take is quite unique. What is our patient population telling us that we're not addressing? And that's a different lens, right?
Yeah. It's a different approach.
So, and I really pride myself in that. Like, lessons learned over the years, Alex, quite honestly, is, the best technology in the world won't move the needle unless the people that are using it feel like they're heard and supportive, and we can have a measurable difference, right?
I love that approach.
And I think, honestly, I just think being a pioneer and a disruptor is exciting. Like I mentioned before, it means you have no roadmap, and you can't really lean into expecting great things in what you leave in the industry or your journey here, unless you expect and can visualize change, right?
Mhm.
And change comes from being present in the moment, and stop reinforcing, things that are not working. You have to believe that you are, um, can create something different. and we can reimagine what success looks like and what that successful experience for the patient looks like and that successful outcome.
Mhm.
I'm all about, you got to live dangerously, maybe with a little bit of caution, but you got to live dangerously and push the label.
Absolutely. Well, it sounds like there's a lot of really cool things you're doing. Again, I love the approach that you're taking to healthcare. I think this disruption is a very necessary thing in the system we currently have. And so thank you again for sharing a lot of what you guys are working on and doing. If there's someone out there who wants to connect with you more and either ask you questions or just talk a little bit more about this, what would be the best way of getting a hold of you?
The best way to get a hold of me is definitely probably through email. That is definitely, and I'm very accessible. I'm always encouraged. I love to mentor people. I love to have these, you know, uh, reflective discussions on brainstorming on how we could do things better and differently.
Well, perfect. And would you mind just saying your email so if anyone listening wants to write it down?
Absolutely. It is uh, Delp, DELPP at carenu.com.
Perfect. Well, again, thank you so much for jumping on here, and we really appreciate all that knowledge and insight that you shared with us today.
Thank you, Alex. Thank you for your time. Truly appreciate it. Have a
Absolutely. And
great
we'll catch
day.
everyone on the next episode.
Thanks for tuning into Success in Motion. Want to share your story? Visit successinmotionpodcast.com/guest to apply and be featured on the show.